Forensic rheumatology involves the application of rheumatological knowledge to legal cases, often related to issues of medical malpractice, personal injury, disability claims, and criminal investigations. The forensic aspects of rheumatology encompass several important areas. 1. Disability assessment. Rheumatic diseases such as rheumatoid arthritis, RA, ankylosing spondylitis, AS, and lupus often lead to disability. Forensic rheumatologists may be called upon to assess severity of a patient's disease, functional limitations, and the eligibility for disability benefits. They provide expert testimony on whether the patient meets specific criteria for legal disability. 2. Personal injury and compensation. Rheumatic conditions can be aggravated by trauma or accidents. Forensic rheumatologists evaluate whether an incident, such as a car accident or workplace injury, contributed to the worsening of a pre-existing condition like osteoarthritis or triggered conditions such as fibromyalgia. These evaluations can impact compensation and liability decisions. 3. Medical malpractice. In cases of suspected medical malpractice involving rheumatic disease, forensic rheumatologists evaluate whether standard care practices were followed. This could involve misdiagnosis, inappropriate treatment, e.g., prescription of corticosteroids, or failure to recognize early signs of diseases like RA or systemic lupus erythematosus, SLE. They provide expert opinions on whether the standard of care was breached. 4. Drug-induced rheumatologic disorders. Forensic rheumatologists may be involved in cases where drugs have led to rheumatic diseases or conditions. Some medications, such as certain antibiotics or chemotherapy agents, cause lupus-like syndromes, vasculitis, or arthralgias. Forensic specialists assess the causal relationship between drug exposure and the development of rheumatologic symptoms. 5. Occupational rheumatology. Forensic rheumatologists often evaluate work-related rheumatic conditions, such as repetitive strain injuries or conditions like carpal tunnel syndrome, tendinitis, or bursitis, which can be linked to certain job activities. They determine if a patient's occupation contributed to the development or worsening of their condition. 6. Criminal cases and abuse. In rare cases, rheumatic findings may be relevant in criminal investigations. For example, distinguishing between physical abuse and bone or joint damage from chronic diseases such as osteogenesis imperfecta or long-term steroid use can be crucial in cases involving child abuse or domestic violence. 7. Insurance fraud detection. Forensic rheumatologists may be involved in cases where there is suspicion of fraudulent disability claims or exaggeration of symptoms. They assess whether the clinical findings and reported symptoms are consistent with known disease processes or are being exaggerated for financial gain. 8. Autoimmune disease as cause of death. Rheumatic diseases like systemic sclerosis, SLE, and vasculitis can be life-threatening. Forensic rheumatology plays a role in autopsies and legal investigations to determine whether a patient's death was due to complications of a rheumatic disease or if it was a result of unrelated factors. Forensic experts in rheumatology are invaluable in bridging the gap between clinical rheumatology and legal proceedings, ensuring that medical, legal, and ethical standards are maintained in the evaluation of patients with rheumatic diseases.